Hey everyone, it's Dr. Konrad Sarosiek here at Cool Springs Plastic Surgery. Thanks for joining me today. I've got another pretty exciting patient story to share with you about a patient that came to see us for a rhinoplasty. So this is a young lady who was concerned with the way that her nose appeared. And you can look at here on the front view, you can see her nose comes down and it's slightly curved towards her left side, towards this side of her face. You can also see this sort of irregularity where her nose doesn't look smooth as it comes down from the top of the nose all the way down to the tip. So that was concern number one. And concern number two, when looking at her from the side, you see this little raised ridge here. In medical terms, we call that the dorsal hump. And she's got a little bit of a dorsal hump that you can see that bulges slightly upward right here around this plane. Her nasal tip right here is a little bit over-rotated. We're going to adjust that as well. But the primary concerns that she came to us for again were the slightly curved nose to the left side and then this dorsal hump. So for her, I wanted to show you guys on a schematic what we did before I actually show you her before and after photos. So this is a schematic of the nose, and people a lot of times will ask us, well, I heard that you have to break my nose. What does that mean? Why are you breaking bones in my face to fix my nose? My nose is here, it's soft. Well, the nose itself actually is quite a complex structure. It's composed on the outside of skin, but on the underside you have a lot of cartilage at the tip or the distal part of the nose. And you can see down here, these are called the lower lateral cartilages, and up here we have the upper lateral cartilages. And at the spot where the cartilage moves to the spot that doesn't move above, right here is a transition point. And that transition point is between this upper lateral cartilage and the nasal bones up here that are attached to your skull. So the reason why we have to break bones is that in a rhinoplasty, when reducing that dorsal hump, when trimming that tissue, we can cut the cartilage because it's soft, just like when you feel your top of your nose. But the area above it is not soft. It's very hard, it's rigid, right? It's made of bone. So this is where the bone breaking takes place in order to create a nice smooth contour of that dorsal nose so that the bones transition smoothly with the cartilage underneath. So that's what determines the reason why we have to break bones to set a nose. So let's take a look at her before and afters. So here's her before picture, and this is her about 6 months after. So again, you see this irregularity here. Nose is slightly deviated to her left side. And then here's on her after photo, you see a nice smooth contour. Notice that there is no bulging on that left side here. The nose comes down beautifully, just straight on down the middle. It has a nice smooth silhouette. And then let's take a look at the side profile on her. This is probably where you see the biggest difference, is that hump that she had right here is now gone. And notice how her nose now comes down very smoothly from the top of her head and transitions into that nice dorsum that's flat, smooth, and then you get this tip that's slightly raised. We call that a little bit of a super tip break, about 0.5 millimeter to 1 millimeter. And you see that that tip now is much more shapely. It actually helps to change the overall appearance of her entire face when looking at her from the side. You know, and we just did her nose. We didn't do anything to her chin, and notice how much of an improvement in her facial appearance that one thing can do. I'm going to show you one more picture, a diagonal shot here. So again, we're looking at the before picture. Comes down. She's got a couple of little bulges out here, a little bit of a dorsal hump on the dorsum of her nose, and then here you see nice smooth contour, no irregularities. The nose fades very evenly onto her cheek. So thanks so much for joining me. I hope I showed you today how just a little bit of a rhinoplasty can truly alter and reshape someone's face. The nose being so important because it's right in the middle of your face. So thanks again for watching, and hope to see you next time.